So I would start with Dr. Akosua. She's a primary care physician in Boston. She's also passionate about preventative care. Her commitment to holistic wellness makes her an invaluable resource for understanding health before, during, and after pregnancy. And then I would go on to Ms. Clarissa Henry, a passionate advocate for maternity and child health. Clarissa holds a master's degree in public health. She began her journey with Low Home as an intern and is now a board member focused on improving health outcomes for pregnant women and mothers in Worcester County. And then I'll go on to Dr. Aloise Eldens Price, board certified family medicine and fellowship trained in obstetrics. She works in General Lawrence Family's healthcare, caring for patients across all ages. She dedicates much of her time to high-risk obstetrics and plays a critical role in training and supervising resident physicians. And then I will go on to Dr. Zach Mazzone, osteopathic family medicine physician. He's dual board certified, integrates natural remedies and lifestyle strategies into his practice. He collaborates closely with midwives and provides comprehensive care for mothers and their babies. And last but not least, Dr. Kim Amazon. Oh, okay, that's fine too. She's has over 20 years of experience as a doula and a childbirth educator. She is deeply committed to supporting birthing couples. Her diverse background in education and health, combined with her journey as a enterprising midwife, equips her with a unique insight into birthing process. So we're really truly honored to have each of our speakers here today. And I'm looking forward to learning and growing. We have 4 sessions today. We have the pre-pregnancy session, we have the pregnancy session, we have delivery and postpartum. So we'll go through each of the sessions. I think that naturally what's coming to mind would be just having a conversation with our audience here. I think naturally some of the topics will weave into one another, and then leaving an opportunity at the end, 10 to 15 minutes for people to come together and ask questions. How does that sound? Right? Okay. So we'll start with Ms. Clarissa Henry. So if you could please tell us about some foods for future pregnant women. What are some foods that we could have? Yep, she has it.
Yes, okay. So in general, there's not much to change up to a diet for pregnant women, but it is, so I'll do like some do's and don'ts. So like do's would be any lean meats, poultry, like chicken, eggs, stuff that are high in folic acid, which is like beans, lentils, nuts, and green leafy vegetables. Those are all like very good. There's also stuff that are high in DHA, which is basically an unsaturated fat. And that is found in salmon and tuna, obviously cooked though, it has to be cooked. And that's actually DHA, sorry, is actually good for the baby's brain and eye development. So those are really good things to eat. Also high iron foods like tofu and lean red meats are very good. Whole grains, oatmeal, brown rice, whole wheat bread, those are all in the whole grains. And then the don'ts, like I said, it's not much, but the few that you are supposed to stay away from are very important. So any soft cheeses, unpasteurized milk products, such as like, I don't know if anyone's heard of cotija cheese. Those are like unpasteurized milk products. any undercooked meat, fish, or eggs, sushi of that form. So those are kind of a general understanding of foods that you should avoid or foods that you should increase when you become pregnant.
Oh, thank you so much. But I have a quick announcement. There's a Nissan Pact that's somebody needs to move their car. So if you're the one who has a Nissan, a black Nissan, um, oh man, yeah. So yeah, yeah. Okay, that's been sorted out. We'll go on to the next question, and I'm glad you didn't have to leave because the next question is you who has been selected to respond to it. So tell us about exercise for pregnant women.
When I heard that I was doing exercise, I wish my husband was here because I'm pregnant, but he's the one who gets me to exercise. Um, but anyway, I mean, exercise pre-pregnancy is very important. I mean, so is, during pregnancy as well. And, just like a couple of things, a couple of notes I just wanted to, just to bring up. Sorry, just give me 1 minute. Okay, good. Okay, good. So, in general, the recommendations for sort of all adults is at least, like 30 minutes of moderate physical activity, for about 5 days a week. So that ends up being about 150 minutes where you're exercising. And by moderate, it doesn't mean like hit intensity level exercise, but, you should be able to be like talking, maybe a little bit out of breath, but have a conversation when you're doing that. And with pregnancy, that's still the recommendation that we try to still hit those. And the benefit for that in pregnancy is quite multifactorial. One thing is, with pregnancy, people who don't have diabetes or hypertension can develop gestational diabetes, gestational hypertension. So, sort of not having those things pre-pregnancy does not guarantee that, you can't have those things happen during pregnancy. So the recommendation is that we still proceed with that kind of exercise. And I think Sister Josephina and I were talking about this, like when you're pregnant, probably not the time to start training for a marathon, like you don't need to show off that you can exercise that much, but, just keeping that in mind. There are some exercises you should avoid, right? And I think also in discussion with your OBGYN or, midwife or family medicine doctor, etc. For instance, maybe don't start boxing, when you're pregnant, right? Or, skydiving, things like that. Because if you think about it, increased risk to mom and then also to baby as well. So you just want to be very mindful about those things. Hydration is so important, because with pregnancy, your vessels are already opened up. You have a very high risk of feeling dizzy and lightheaded. So you just want to be very cognizant of being super hydrated. And with pregnancy, the one thing they will tell you is that, when you are in very warm environments, it can increase the risk for defects in the developing baby as well. So maybe you don't go do some exercise program in a very hot environment, like anything in a sauna or anything like that, just being a little bit, guarded with what kind of exercise you do. And I think this is something that I learned. Like weightlifting is fine, but the one thing I learned is that probably not the time to work on abs, especially as you go further along in pregnancy, can actually end up sort of making things worse in terms of diastasis and things like that. And I think the one thing that maybe in the US, I don't think we do very well is pelvic floor as well exercises. Unfortunately, we don't have a lot of pelvic floor physical therapists. And a lot of them, the ones we have that are covered by insurance, a lot of folks tell me they tend to really book out and there are costs associated with that. But then it really does help, I should probably listen to myself speak with this one. But, thinking about reducing the risk of things like urinary incontinence, helps with labor, helps with recovery postpartum as well. So I think that's a key thing about pregnancy that I don't think we talk about a lot. Sorry, let me see if there's anything else I wanted to know. Yeah, I think those are really the big things is, so basically keep on moving, lots of benefits. You shouldn't ramp up, while you're pregnant. Also, the other thing I should also note is, not all pregnancies are the same, right? So with everything, we say things generally, but then, different women will have different risks they need to think about. For instance, a pregnancy with multiples is very different from a pregnancy with singleton. So if you have twins or triplets or even more, you probably want to talk to your OB about what exercises you can do safely, because they're a little bit stricter with, they may actually say, don't exercise, if you have a very high risk pregnancy. So that's the one caveat I say. Exercise is good, but please check in with your OB, especially if you have anything that sort of puts you at a higher risk than, I guess, typical pregnancy courses.
Oh, thank you so much, Ms. Clarissa Henry, for your wonderful education on foods, and then Dr. Akosua about exercise. Next, we'll be talking to Dr. Edens Price about impacts of current lifestyle on future conception.
So you've heard a lot about diet and exercise, and those are the same things that we want everybody to consider when thinking about going into pregnancy. The other things that are important, there are some substances that people should stay away from, like alcohol, cigarette smoking, drug use, marijuana use. If people have been habitually using substances, they should try to stop or get the habit under control before considering pregnancy. Also, we need to think about making sure that people are fully immunized. There are certain diseases that we don't want you to get during pregnancy. For instance, if you've never had chicken pox, you should really get immunized against that. And also measles, mumps, rubella. Most people have had these, but there are some people who they test negative that they've never had these. So people should get their immunizations in before then. And if you have chronic diseases, you should really get them under control before considering pregnancy. You don't want to enter pregnancy with your diabetes out of control, or your high blood pressure out of control. If you have other chronic diseases, then you should work with your physician to make sure that they are at a place where it's safe to have a pregnancy.
All right, thank you so much for your insights on what we should do and what we shouldn't do as we look at pre-pregnant. My next question is for Dr. Zach Mazzoni. What are some general guidelines for couples planning to have children? Some general lifestyle guidelines.
So general guidelines as far as preconception, I'd like to go off of what we talked about. The time, if you're considering getting pregnant, the time to start working on it is now. As soon as you start thinking about it. And one of the things that I wanted to share is it's really important for you to become an expert, right? This is going to be your pregnancy. This is, if you're a husband, this is going to be your child. And this is a time for you to personally start to research and to review things. My wife and I put together a handout up here if anybody wants it. It's about general lifestyle principles that you can put into your daily routine that will help you as far as conception, as far as carrying the baby, as far as labor and delivery, and afterwards. And I would just go back and say that, a lot of the things that were said are very important, but we're talking about preconception here and conceiving. One of the things that I want to mention that people don't talk a lot about, but they should, is the toxins that are in our society are very, very powerful and are affecting our capacity for reproduction. And so let me give you some specifics. Does anybody know what glyphosate is? Has anybody heard of that? So glyphosate is Roundup. You've probably heard of Roundup, right? Glyphosate is used, and currently in the United States, it's used to desiccate or to dry our wheat crop. Anywhere from 90 to 99% of our wheat crop in the United States, if it's not organic, is dried with Roundup. Why is that a problem? The studies that they did in Canada showed that Roundup has a 39% decrease impact on your capacity to conceive a child. Now think about that. 40%, right? And that's not the only one. Right? There's several other organophosphates, there's several other pesticides. When you talk about food, you really want your food to be as pristine as it possibly can, because if you're continuing to get these pesticides or any kind of toxins into your body, as we do more research, things like in our plastics, like bisphenol A, they decrease your capacity for conception. And it's not a small amount. It's anywhere from about 25 to about 50%. So this is a major factor for trying to conceive. So thinking about your lifestyle and trying to make it as pure and as simple as it possibly can be. And sometimes that can be difficult, but if you do the research on it, you can find food containers, you can find foods, you can find exposure to certain foods. There's a website that I would encourage people to consider going to. It's called Environmental Working Group, EWG, environmentalworkinggroup.org. They will give you a list of foods called the Clean 15. These are foods that don't need to be organic, and you can eat them and they don't have large impact. But there are certain foods, even if you're trying to eat quality, I'll have somebody come in and tell me, I'm eating great quality. And I think, okay, if you're eating these dark green leafy vegetables that we talked about, if they're sprayed, you're getting the dark green leafy, you're getting great amount of folate, you're also getting toxins, right? So you want to think about, okay, how do I avoid the toxins and maintain that kind of healthy lifestyle? So preconception, really, really important. Some of the other things that I would talk about too is, we don't talk about it as doctors, but I think we should. Stress plays a massive role in health and disease and on the capacity for you to conceive. So if you're in a very difficult situation, it can be adding to that. So you'll want to be able to do certain things. One of the great stress reliefs, believe it or not, that we have is exercise. There was a study done in 2014, the Scientific American, that said that the best treatment so far tested for anxiety was exercise. Fantastic. And so like it was said, you're not going to train for a marathon. This isn't the time for you to show off how much you can weight lift. But it is a time where even if you haven't had exercise before, walking at a moderate pace, continuing to release things in your body that open up your blood vessels and allow more blood for you and for baby, critical, right? So starting that process of, if you will, detoxifying, trying to get into more of a pure viewpoint. Dr. Eloise talked about the importance, and I don't want to reiterate that, of if you're struggling with a condition right now, and the primary ones in pregnancy are going to be hypothyroidism and diabetes and high blood pressure, okay? If you're struggling with that right now, find a doctor that can help you to really have those be in a very good condition prior to going into pregnancy, because if they're not, they can affect you, obviously can affect the child. In addition, I would tell you to look at other toxins that we don't talk about a lot. I'll end on this. Heavy metals play a very big role. And I'm from Maine, but in our state, they recommend that anyone who's trying to conceive or anyone who is actually pregnant has no more than 4 ounces of fish per month. 4 ounces per month because of mercury contamination, right? So I would encourage you, again, get smart on this. Go out and take a look at some of the concerns, because mercury, although it doesn't result in birth defects for every child, depending on the time that you're carrying, can have massive impact on the child and on birth defects. And so if you get pregnant, you don't want to in any way hurt the baby, right? So then thinking about this healthy lifestyle, and you'll notice that there's a consistent theme that we're talking about: getting healthy before, staying healthy through, right? And finding ways to do that. And so those would be my encouragement points for preconception.
Okay, thank you so much. Ms. Kim is on. So we're gonna have, before we actually go there, you talked to us about a resource, environmental.
Yeah, it's Environmental Working Group. E as in echo, W as in Willie, G as in golf.
Yeah.
EWG.
So if you're taking notes and you're,
Very good website to talk about toxicity avoidance and to talk about certain foods that are more healthy for you.
yeah, so if you're taking notes,
Yeah.
please make sure that you keep doing that. Just for a resource outside of here that could be useful.
And I was just going to mention real quick, they definitely talk about food on there, but they also talk about a lot of other things, like even being considerate of what you're using for body care products, what you're using, what are you washing your clothes with, what are you cleaning your house with? And you can actually put whatever brand you're using, and it will tell you, is it good? Is it something that you might want to think about changing? Or are there things or chemicals in that particular brand that would be harmful for you? And so it just helps you to be an informed consumer.
Okay, thank you so much. And that's always a wonderful thing, is to be informed. So we're gonna go on to Kim Izone. What are some important dental issue related things to resolve before pregnancy?
I will speak of this. I'll also have my husband, because I know he deals with this with the patients.
Okay.
But routine cleanings, extractions, really no problem with that. However, if you have to have any kind of procedure where you have to go under general anesthesia, it's best to do that before you become pregnant or wait until after to be able to do that. And, I realize that a lot of times in the dental community, they will say that x-rays, even if you're pregnant, are generally regarded as safe. I would just consider that. Maybe, decide to put that off until later just because we don't know for sure. And so we kind of tend to err a little bit more on the cautious side.
Yeah, just a quick note, something to consider from a dental standpoint, and we had kind of touched on this before, is there are a lot of what are called silver fillings out there. And silver fillings are silver, that's where the name comes from, but actually it comes from quicksilver. Silver fillings are 50% mercury by weight. And so if you're going to think about having those extracted, which some people are, you're going to want to find a dentist who is competent and understands how to remove those in a safe manner. And there's several procedures that they should do. I can talk to people about that later. But if you're thinking about conceiving or if you're carrying already, that's not really a time to do that because you are going to expose your body to higher levels of mercury, which is not a wise time to do that. So again, any bigger procedure, I would really have that done well after. And you want to think about obviously breastfeeding because it's going to get into the milk. Or I would have it done well before if you're considering that.
Thank you very much. Please pass the microphone to Dr. Eddins Price again. Regarding pregnancy and diabetes, hypertension, mental health issues, can a woman with diabetes get pregnant, and what should she consider?
So we see pregnant diabetic patients all the time. However, supposedly there's a slight decrease in fertility for diabetics, and more so if the diabetes is out of control. And so the important emphasis here is to control these chronic diseases before you get pregnant, because there's a higher incidence of fetal anomalies when your diabetes is out of control compared with when it's well controlled. And yeah, people with diabetes, they do become pregnant, but especially if they are on insulin before, it's a very intensive, time-consuming journey to pregnancy. And it's worse if it's not controlled. And people have to pay really close attention, especially in the last part of pregnancy, because there's a higher incidence of what we call preeclampsia. That is where the blood pressure increases in pregnancy, and there's protein in the urine, and you could, when it's complicated, you could get the liver affected, your platelet count could go down, and if you do develop eclampsia, which is one of the complications of having preeclampsia, that you get seizures, and that is really a significant complication. So yes, people do get pregnant, fertility a little bit decreased, but we see people journey through with diabetes all the time, but very labor intensive. And then chronic hypertension, yes, we need to get that under control because there's risk to the baby. Yes, there's an increased risk of getting preeclampsia. I guess you'll hear about preeclampsia over and over again in pregnancy. A lot of things that we do during pregnancy in terms of checking your blood pressure every time, checking your urine, checking how much weight you're gaining, asking you how you feel. Those are all geared towards being sure that we could detect preeclampsia at an earlier stage and treat it so that it doesn't progress into eclampsia or some of these other complications. Okay. So yes, chronic hypertension, there's higher risk of developing preeclampsia. And there's also a higher risk that the blood pressure will be so out of control that you have to end the pregnancy early. And so there's a high risk of having a baby that is preterm, that has to go to the neonatal intensive care unit. There's a high risk of having a small baby because these chronic hypertensive baby, the placenta doesn't perfuse as well as usual. And so they tend to not grow as well as normal babies. And that in itself is a high risk situation. If it's too small, we'd have to end the pregnancy and get the baby out, give it enough so that it will grow enough, but get it out at a safe time. Yes, so obesity is another problem that could give rise to these complications. Like they tend to get more diabetes during pregnancy. They tend to get more hypertension, preeclampsia issues. They tend to get more urinary tract infections, clots in the veins. So that's another issue that we have to be careful of. People who are very obese, there's a danger if they have to have surgery and you put them under general anesthesia, it might be difficult to intubate them. So we tend to send people who are very obese to a tertiary center to deliver. So generally speaking, that's how you make yourself aware and try to control these diseases before you get pregnant.
Thank you so much for your insightful comment. I'm going to pass it on for our last question on this session on pre-pregnancy to Dr. Zach Mazzoni. So we're talking about autoimmune disease and management during pre-pregnancy. What does that look like?
Yeah, so I got the easy question. Autoimmune disease, if you're not aware, autoimmune is basically when the body, for oftentimes unknown reasons, starts to attack itself. The one that you see most often would be hypothyroidism, which is very common in pregnancy. And there are different types of hypothyroidism. There's an autoimmune component where the body actually starts to attack the thyroid. These kind of situations can be dangerous, obviously, in pregnancy because the thyroid is very intimate as far as regulation of things like estrogen, other components in the body that are critical to pregnancy. Autoimmune disease, I'll go back to kind of what we said, and I want to obviously support Dr. Eloise and what she said. These conditions often don't present in pregnancy. They can, but often you should know about these ahead of time. This gets back to making sure that you do good follow-up with your primary care beforehand. You should have an idea of where your health is. If you don't, and you're pregnant or considering it, doing labs ahead of time to find out if there's any problem is very important. I will do pretty extensive labs on those, and I will test for certain autoimmune diseases, but there are a lot of autoimmune diseases where they're not diagnosed for a period of time. If you are diagnosed with an autoimmune disease, you really need to, at that point, try to seek out the care of a specialist, someone who deals with these routinely. And that would be endocrinology. That could also be rheumatology, depending on the type of autoimmune dysfunction that you have. And again, you want these to be thoughtful because these can really impact pregnancy. Plus, some of the medications that you could be placed on can really impact pregnancy. I have a female in my practice who was on rheumatoid arthritis, very significant. She was placed on a very powerful medication. We needed to take her off of that medication because she wanted to get pregnant because there's a strong side effect profile for babies and for fetal development for this medication. She came off the medication, had a successful pregnancy. We worked with OB, worked with her rheumatologist, and then she was able to stay off of that medication. But autoimmune disease is definitely something you want to think about because it's going to affect, obviously, baby. But again, the medications and what you're going to do to try to reverse that can be very powerfully impacted to the child. So it's something that's too large. I don't know that you can make a statement about all autoimmune except for this. If you choose to follow a lifestyle that's healthy, and there are several things that you can do. Again, we've got a handout on that, but it's basically talking about your nutrition. Is it really top notch, right? And if you take a look at nutrition-wise, the best nutrition in the world that's been studied over and over is whole food plant-based. Certainly, I know that there's a desire for people to have is meat and dairy, and I'm in no way trying to make a comment about, oh, that's terrible, you can't do that. I am saying that if you really want the best, whole food plant-based, you do need to think about the protein that's coming in. You do need to think about exercise. You do need to think about hydration. You need to think about your stress level. You need to think about the amount of sleep you're getting. And I'm just going to do a quick plug on sleep here. Anyone seen these things? They're called cell phones. Anybody familiar with these at all? So if you're on screen time at night, within about an hour and a half of bed to 2 hours of bed, and you're on these light emitting devices will actually decrease your endogenous, your inside production of melatonin, and it will affect your sleep and it will affect your capacity for pregnancy. So making sure that your sleep is good, right? Making sure that you have good relationships. And then I would say also making sure from a standpoint of a good relationship with God, which I find to be central, right? As far as really making sure that you're healthy, all those. If you choose to do those things, your potential for decreasing autoimmune disease or other chronic diseases goes way down. And in my mind, that's just a no-brainer. It's something simple that everyone can do. It's not expensive. It's very helpful for the whole process. So again, if you have autoimmune, make sure that you have somebody who's treating that's knowledgeable. If that's a specialist, make sure you're watching your medications, and then make sure you're watching your lifestyle.
All right, I was just thinking, how am I going to summarize this? And I think you just hit the nail on the head. You know, New Start is definitely a way to, as a lifestyle that's imbued, that would definitely help us sustain uh, a good habit, so that when we get pregnant, we have all um, the right amount of information to keep our bodies healthy, our babies healthy, and our families healthy. Done with that session, we're moving now to pregnancy. First on the list is Dr. Eddins Prize. Can you tell us a little bit about diet in pregnancy and food to increase or avoid? I know Dr. Miss Clarissa Henry just mentioned things relating to pre-pregnancy, but what can you tell us about
Actually, she did
pregnancy?
talk about pregnancy too.
Oh,
So-
okay. Yes, she did. She did.
Yeah, but basically what we tell them to do is eat a healthy diet, and the more plant-based, the better. There's enough protein in peas, beans, tofu, these things. And it's much more healthy than the animal products. Yes, so I'll just reiterate what she said. To avoid soft cheeses, be sure that your vegetables are properly washed, because these could be contaminated. You could end up with salmonella, listeria. Don't eat sushi because that meat isn't cooked. You need to. And she talked about, well, there's talk about deep sea fish that contains mercuries, shark, kingfish, tilefish, these types of fish, tuna, from just anything from deep sea tend to have more mercury in it. And so you try to avoid that. But based on what you said, that's the general rule for eating in pregnancy.
Okay. Go ahead.
I don't think anybody will disagree, but one thing that you want to think about from nutrition is, if you're contemplating pregnancy, is you really need to be on a prenatal vitamin. Even with the best nutrition, and I do routine testing, I see people that are low in B12, low in vitamin D, they're low in folate, they're low in iron. And iodine, we don't talk about iodine, but there are some studies that would show that iodine does greatly impact fetal development, including IQ. So, something from a nutritional standpoint, you do want the best food you can get. That's still not a substitute really for prenatal vitamins, or at least talking to somebody and making sure that you're being tested that you don't need them.
Yeah, I usually tell people to take folic acid for at least 3 months prior to pregnancy, because that will prevent abnormal development in the brain and spinal cord.
The microphone to Miss Henry. Yeah. Would you rather me call you Clarissa? Is that easier? Doesn't
Whichever's
matter.
fine.
Okay. So yeah, can you tell us about, I think your the question kind of links with what we just talked about, prenatal influences and preventions of birth defect. So what are some things we need to be mindful about that could potentially make us at risk for birth defects?
Yeah, so obviously, genetics play a role. So it's a part of the pre-pregnancy is also doing any testing that you can do to see if your child could possibly be at risk for any birth defects. And I know we just talked about neural tube defects that can happen or that can occur based off of some foods that you can eat. So that's something to take into consideration as well. Um, I'm trying to think, sorry. There was something else. Ooh, I missed something. Sorry, I'm kind of going blank right here. But I think for the most part, I would say like prevention wise, everything is about getting as much information as you can. I know that it was mentioned earlier to become the expert. And I think that is the biggest thing, especially when it comes to advocating for yourself. Whether it's to healthcare providers or whether it's to doulas, midwives, or even to family who want to intrude and feel like they can have a say. So I would say knowledge is the best prevention. Knowing your family history is a big thing as well prior to getting pregnant should be considered as well. So I don't know if anyone wants to.
Sounds good. There's not a lot you could do about these hereditary diseases until, I mean, people are not going around and getting tested, generally speaking. But when they do get pregnant, we offer them testing to see if they have these diseases. And then you might know a common thing we see around here is like sickle cell disease. So a lot of people, they don't have the actual disease, but they just have one gene for it. They have the trait. And if you know that the man that you are with has the trait, then there's a good chance that some of your children will get the full-blown disease. And so it's very important to know the history of your spouse too, in addition to your family history. But generally speaking, there isn't a whole lot we do pre-pregnancy. It's usually after you get pregnant, and we don't see a lot of these diseases, these hereditary diseases that significantly affect your life, but occasionally there's a rare case.
Okay, that's okay. Go ahead.
I just wanted to add one thing. I think it also depends on the person, because I definitely have, folks. So I think number one, I think before, for instance, if you're Black and you're getting pregnant and you talk to your doctor, they'll say, oh, test for sickle cell disease. Let's say you're Caucasian. Let's say, okay, things like cystic fibrosis. But I think right now they've realized that, the recommendation is not to sort of just test based on how you look, because, there's so much diversity and, so many kids born out of parents of different origins that, right now, the recommendation is if you talk to your primary doctor or your OB, midwife, etc., about testing, it's there as something that can be offered to you, even if there's sort of nothing in the family you're worried about. And it really does depend on sort of people and sort of their threshold for what kind of child I want to have, I suppose. I have folks who say, you know what, I'm just going to get pregnant and see what happens, because I know that I would keep baby no matter what happens. And you also have folks too who are sort of very strict on, sort of like trying to avoid every single thing they can avoid. So just a plug-in to say that if there's, for instance, if your family member has sickle cell disease, of course, get tested pre-pregnancy, see if you have the trait. There's also partner testing available. So this is something that involves you and partner. But for folks who are also just interested, that's also an option, although, it really just depends on sort of like the mom or the dad, in question.
Okay, I think you hit the nail on the head. We're talking about partner already. So this is for you. What would you say as the role of a partner support during pregnancy?
Once again, I wish my husband was here. Speak more to it. But I guess maybe looking at things from his perspective. So I think number one, I think for partners, and maybe this is just from my perspective. Obviously, every single woman is different. So I think everything I say, please check in with your partner. But I think, speaking as a woman, we want, at least I want you to sort of like read with me, so that it's not just the woman who is becoming the expert, we also want the dads or sort of whichever partner to also be the experts as well. So that is, I would like it, I would suggest the partners, sort of read about pregnancy planning, for instance, things like thinking about whether you want to do genetic testing or things like that. It shouldn't be just mom sort of like making these decisions. That should be things like reminding mom to take their prenatal multivitamin. Some of us need a little bit of help with that. Telling mom to exercise. Some of us need a lot of help with that. So, just learning the different stages of pregnancy as a partner in itself can be very important. Attending OB appointments. No, not everybody can attend all the OB appointments. People have jobs. Sometimes partner may not have bandwidth, but in as much as you can to support, that's also very helpful. And then there are also certain physical limitations that can come with pregnancy. I mean, I do think that, at least from my perspective, I think, a lot of things I was able to do pre-pregnancy, I'm still able to do to a certain extent. But some things like lifting heavy things, it's actually not very good for, your abdominal walls, to be doing such heavy lifting. Things like balance, that's something that pregnant women also are not very great at. We fall quite easily, so things like carrying heavy boxes, going up and down stairs, etc. These are some of the things that you want to try and offload off partner. I think then it comes to practical things like baby, registry. Sometimes you just want somebody to look at the registry with you. It's different. Some women want to do everything themselves and choose what they want to do for the baby. For that work for both of you, fine. But I think just really checking in with your spouse and maybe just asking your partner, what do you want me to help you with? But then also doing your own basic research, just so it's not always like the mom feeding you information. Sometimes we also want you to give us your ideas and ways in which, you can support the pregnancy. Because I think pregnancy to me, it's like if dad and mom, to me, it's both of you, who are in this journey together, not just mom. So I think just that cohesiveness can be very helpful. And also back rubs, massages, it's so important. Foot rubs.
Very important.
Yeah, I was actually gonna touch on that a little bit, because I know in general, there's been stuff that partners can do to help not only take the weight off, I don't know what the word I'm looking for, but not only that way, but also physically. Like I've seen, obviously, like support classes like pregnancy classes that you can go to. Usually the partner being there is very helpful. It can be kind of sad if a pregnant mom goes alone. So having that support. And one thing I want to touch on is also the emotional support. I feel like being pregnant, especially if it's your first pregnancy, honestly, every pregnancy can be different for even one person, but hormones are changing up and down every day. And I feel like the partner, like, I'm not asking for too much, just asking you to hold on for the 9 months while she may be cranky. She may wake up one day and be in a great mood, wake up the other day, not feel so well, or, giving into their cravings sometimes. If she wants a little pickle with with some peanut butter on it, it sounds crazy, but just do it because it's a way to show support. And I think that's a big thing, especially, I know we haven't really gotten to it much, but like the mental health aspect of pregnant women, if you even have a history or a personal history or a family history of any mental health issues, depression, anxiety, that's also puts you at a higher risk for postpartum depression. So it's something that you definitely want to discuss with your partner, and also, so they could be there for you and have that support system for you. And not only your partner, but also your family. But I know we're talking about specifically about partner, but yeah, that's also very important. Emotional support.
Excellent input. I just wanted to mention as well, I teach natural childbirth classes, and one of the things I like to really emphasize is we hear a lot about the physical, the emotional, but it's important to look at the whole integrative person, and we're spiritual beings as well. And so being able to have a spiritual time together as a couple, if you've never ever done that before, this is a wonderful time to explore. And it can be something easy, like even something we started a long time ago that we still do now is we like to walk our prayers. So we will walk in the morning before we go to our clinic, and we will pray. How can I pray for you? We pray for our children. We pray for people that we know. We pray for friends. And it's easier when when you're walking and you're enjoying nature, you're out in the fresh air, you're out in the morning sunshine. It just really lifts your mind to spiritual things anyway. But we found that really brought us closer together as a couple. And I know that the Bible is a very ancient book. but it has very timeless wisdom. And we found that, looking through the Bible and finding promises, I will give you peace. You can be at rest. You do not need to be fearful. And really, I can do all things through Christ who strengthens me. Focusing on those together as a couple and taking that into our birthing experience was very helpful. And so I'd like to just encourage you that if you've never explored, a spiritual relationship together, and also continue to keep your communication open, because like you said, things are changing for mama all the time. And the women get a lot of focus in pregnancy and through the birthing experience, but let's not forget the men. So let's be good partners. Yes, mama needs lots of support during this time, but so does the dad. And so having that open communication. How are you feeling about being a father? What are your hopes? What are your fears about, us coming together and having this baby? And really having a time of communication and keeping that communication open so that you can come close. Because often I've been a doula for 20 years and now I'm an intern midwife. What we have in our relationship, we take into our birthing stories. And so if we're having issues, if there's things where we are, issues between us now, if you can talk about those as a couple, and if you need to, get some, see a counselor. We've done that at different times in our lives when there were things that we were trying to focus on. And sometimes just having an extra person out there to help you talk and deal with things is really, really helpful and healthy to do that. And so we just encourage you to do that because it's a really beautiful time as you're planning for your family, as you're looking forward to your birth, and will help you to stay strong as a couple as you head into that transition to being parents.
Okay, before you, yeah, pass, that's for you. Dr. King was on me. So we're gonna switch hats now and talk about substance use considering during pregnancy. What are some considerations substance use during pregnancy? What does that look like?
I think, we've already mentioned it as far as substance use. The most common one that we see generally is alcohol. And there was a time where they said in the medical literature that alcohol actually had some benefit to it. If you take a look at the recent studies, what they show is that it actually has zero benefit to it. So, alcohol has no good place in life, nor does it have any good place in pregnancy, nor conception, and actually can decrease the capacity for that. Other substance use, we get back to what we talked about earlier, and I know that this is kind of a recurring theme. Do you do things a few years before that can affect you? Think about anything that's going to affect your genetic makeup, right? Because the way we're designed, our genes are designed to be eternal. It's interesting if you think about it, right? But there's these little caps on the end, and if those get damaged, then they start to fray. And as they start to fray, then things get into the genetics. And as they get into the genetics, malfunctions start to happen. Diseases start to happen, right? Fetal abnormalities start to happen. And so it really, any kind of damage that you're going to use through substance use is going to carry into the genetics and is going to possibly carry into the child. So, on this, from my standpoint, this is a capacity for you to have the freedom to say no to things that are bad, which is part of really having a healthy lifestyle, is the ability to say no to things that are bad and yes to things that are good in moderate use. And so that's what I carry through. And in substance use, I've been a doc for a while. I've never told somebody, man, you got to knock off the water. That stuff's going to kill you. You got to stop eating those vegetables. But what I have heard from my patients a lot is, really wish I would have stopped drinking. Damaged my marriage, right? Damaged my upbringing. I am having problems with marijuana use. I'm having problems with drug use. And I know that we've seen it in NICUs, but if you see a drug-addicted baby, it's one of the most heartrending things you're ever going to see. Babies just uncontrollably crying because they're withdrawing from opiate use. And so there is no place in my mind for preconception or for carrying a baby or afterwards for substance use. I've only seen it do. I've only seen it do. So.
Yeah, go ahead, Clarissa.
I know even with the alcohol and drug use as well, you can consider like environmental factors as well. I think that that's very important because when you look up environmental factors for pregnancy, alcohol and drug use is like number one. But also considering the area that you live in. If you live near a chemical plant, if you live in a like lower income area where say the water isn't amazing, like the water quality, even air quality. All those things can affect your baby. It can also affect guys too. Because I think it's, yeah, chemical exposure, any type of chemical exposure can reduce the quality of the sperm or eggs. So that's something like considering your environment is a big thing as well when it comes to substances around you, not only the ones that you physically put into your body, but the ones that are just literally in the air. So
It's interesting because we trigger each other. So one of the things that I would note too is that water, I would be careful with water as far as the quality of the water if you haven't had your water tested. There is also some studies that talk about chlorinated water and its impact on fertility. So if you're in a chlorinated water situation, you may want to think about that. There are certain filters that you can get that will take some of the chlorine out. The other thing that we're really starting to study now from the medical community is the impact of microplastics. And so there are plastics just that are ubiquitous. They're everywhere in our society. And so from a standpoint, these are little things that you can do, right? If you have a plastic water bottle, well, get a metal water bottle, right? Try to do small things. And then the last plug that I want to just remind people is, I don't know if you're like me, but the more you study, the more little voices you have in your brain. And you're like, oh, can't do that. I can't do that. Watch out for that. And so I would just remind yourself too, this is a beautiful process. My wife was never so beautiful as when she was pregnant. She's beautiful now. I'm not saying that, but it is such a beautiful process. And so being able to enjoy it, being able to remain hopeful during this process, trying to focus on things that are good, because there's so many things that can be negative, but really trying to, at the end of the day, what my wife and I do is we call it, what was your joy today? Started with my daughter, because she couldn't say enjoy, but focusing on things that are joyful, that are good, that will actually release certain hormones that make it easier for you in pregnancy and for labor and delivery. So I would just say, that's one of the things that you want to lean towards. So
Okay.
thanks.
So it's got. You say-
Really quick. I was just gonna say, so I have a lot of, as I'm primary care, I have a lot of young patients, and I think also cannabis, that's one thing that I always like to emphasize. I think there's been such a proliferation of profits making, cannabis company. I think on social media, especially, it's being marketed as it's great. Medical cannabis is great for you, and there's not a lot of regulation. I mean, it's legal, so you can easily get your hands on it. And because so many people are using it now, I don't think there's a lot of, alcohol, I think we've known about opioids, but cannabis, but now there are studies showing that it affects fetal development. So I've been using that as saying, okay, there's proof that cannabis is not great for pregnancy and it's not great for developing babies. So just because I just see it so much around me, I just wanted to make a huge platform. Just be really careful with that product. Yeah. Avoid it. That's what I should really say.
Yeah.
They should really avoid it.
So yes, but the other thing about cannabis is that they still consider it as a substance. And if you've been using it during pregnancy, you get flagged. And then they will have to get DCF to come and investigate and all that. So even though it's legal, they still have that.
Okay. So in summary for sessions, the second section of pregnancy, I think that it's important that we pay attention to habits and routines, pre-pregnancy, during pregnancy, because I think Dr. Kosovo said something very profound about what kind of child do you want to have, right? So you do things with the end in mind, always making sure that you're conscious of the health repercussions and the baby that you're carrying, supportive partner, I think supportive family members, right? Supportive church family, because it takes a village to bring a child into this world and nurture it. So we're gonna go on to delivery now. So this is now a question for, this is now a question for Dr. Ms. Kim Mazzoni. So preparing for natural delivery, what are some tips and some timings that we need to keep in mind?
I know one thing that every person here has said is be informed. Read, ask questions, and really find out, how does a baby develop? And what's happening in mama's body? What are the changes? You know, this is not a medical event. It is a natural, normal process that our bodies as women were created and giving the gift to birth. And yes, sometimes things come up that are medical, and thank goodness we have, you know, the specialists there when we need them. But by and large, for the majority of women, this is a beautiful, natural experience. I'd like to encourage you to take a childbirth class that focuses on natural delivery and can give you some ideas of what can I expect as far as a labor unfolding. How do I know I'm going into labor? How does a normal, natural labor progress? And, you know, and ask questions. I have a couple I'm working with right now. They're having their fourth baby, and they never went to any childbirth classes. And when I started working with this couple, the husband told me, he said, I don't want to be at the birth. Of course, I was like, what? That was the first. I don't want to be at the birth. I don't want anything to do with it. And talking more about it, because he had no idea what to expect. He said, I was very traumatized during our first birth. He said that I saw my wife, everybody was focused on her. No one had ever prepared me. I didn't know that the baby can, be a little bit blue initially when it comes out, and that's okay. He said, I was so he said, I have PTSD. And he said, I've been through it 3 times and I can't do it again. So, really go together as a couple and find out, what does it look like? Also, implementing, we have a handout here with 8 different health habits on it that you can take with you, implementing those into your life. And some of these we've already talked about today. Being prepared physically and mentally, emotionally, spiritually is going to help you as you're getting ready for a natural delivery. Then I already talked about focusing on that relationship between the mom and the dad and making that a priority. And then address any fears that you might have around labor and delivery. The media portrays sometimes birth as this stressful, scary, oh no, event. Or I don't know if you've ever gotten together sometimes with a group of women and they start talking about their birth stories. And sometimes it seems like they will try to up each other on who had the scariest birth. Don't listen. Just remind them nicely, hey, positive birth stories, please. Okay, focus on what is good and really address any fears that you may have. You can talk with your midwife or your obstetrician, talk with a trusted elderly woman in your faith community or in your community who's had positive birth stories, but find someone that you can talk to and get those fears addressed ahead of time. And then meditate on I know my husband said, what is true? What is good? What is beautiful? What is lovely? Focus on what is positive as you are going into this. Because like I said, your bodies were created to do this. And when we go into that birthing process, it's amazing because your body just takes over and does what it's supposed to do. It's pretty miraculous, really. And then just trust God in the process.
Okay. Thank you so much for sharing all those wonderful tips about preparing for natural delivery.
Question.
Go ahead.
What would you consider to be unnatural?
Good question.
Okay, something that might be unnatural. Well, I know that for myself, my first baby came almost 7 weeks early.
Mhm.
And so the birth that I had planned, while still natural, was really different than what I had anticipated. And I know sometimes there are situations that come up. There are medical situations where, because for the safety of the mother and the baby, we have to have a cesarean birth. And thank goodness we have the options for that when something, comes up in that situation. Those are a couple of things.
So you consider anything that is not smooth to be unnatural?
This is a question that was actually prepared for you, Dr. Price, is what are some natural delivery, what are some pros and cons for natural delivery versus C-section?
So that is one question. I mean, what is a natural versus unnatural?
Go ahead.
I just,
Zach.
yeah, I think, I don't want us to get into a situation where it's an either or. I think it would be more healthy for us to look at this as maybe a spectrum of, I would say maybe unassisted childbirth to needing a lot of assistance, and that will be situationally dependent, and that it's not a statement about what's better or worse, but what's needed for the situation. And I think in my mind, that's a healthier way to look at it, because we have this capacity to have everything from, when you're talking about, there's home birth. There's a movement now called wild birth. I don't know if anybody's familiar with that. And it's a response currently in our society where they're saying, we want no intervention. The women were meant to do this. We do it wild. We don't have any help. The problem with that kind of attitude, and I'm not trying to point fingers, but the problem with that type of attitude is to say that you can't get help from different viewpoints. And I think it's really important when you go into this, there's going to be different viewpoints. We should embrace that. People are intelligent. They generally come to a discussion with really good points. And generally what we find is that if you understand somebody, you get a better understanding with many people having input. That's a more full understanding. So I would say for our discussion, I think natural is maybe not helpful. I would almost ask that we maybe use a unassisted to a more of an assisted situation, because there are certain times, and I know that we've seen this, where I've seen it where a baby's going to die unless it's a cesarean. And that it was a wonderful birth with a healthy baby and a wonderful outcome that would not have happened, but it needed to be assisted, right? So for what's worth.
Oops, sorry. Go ahead.
So thanks. Yeah, that is what I was trying to flesh out. Like, I guess natural means different things to different people, but we don't generally use that term. We talk about normal spontaneous vaginal deliveries versus C-sections. So you can have a normal spontaneous vaginal delivery even though your labor close was complicated. And there are some people, they have no problem at all. They go in and they arrive and they're almost completely dilated and they give birth without any problems. But other people, they develop complications during the labor course. Some people might come in with, you know that this is a really small baby. They might have enough amniotic fluid. The placenta isn't operating properly. And these days we do continuous fetal monitoring for most all patients if they end up in a hospital delivery room. And people watch the heart tracing throughout and pick up areas where it might portend problems, like depending on the pattern you see, then you might think, okay, this baby is not doing well. We have to watch it more closely. We have to do some interventions. And we try as far as possible to get the patient to a point where they could deliver normally by normal spontaneous vaginal delivery. And if that doesn't seem to be what is going to be the best for the baby, then we end up delivering by cesarean section. But cesarean section is a major operation with various complications, even death. But most of the times, almost 100% of the times, there's no problem. Some people might need to get transfused because there's a lot of vessels you have to go through during a C-section and they bleed heavily. There's a higher risk of getting infection after a cesarean section compared with a vaginal delivery. And so we usually give antibiotics before we do the C-section to prevent infection in the uterus, infection in the incision. And also there's a risk because there's organs around the area, the bladder especially could get cut, the intestines could get cut, the baby could get injured. And so it's really a higher risk, more complicated procedure than giving birth normally. So as far as possible, we try to get people to have a normal, spontaneous vaginal delivery. Sometimes this vaginal delivery has to be assisted. In long time days, they used to do forceps delivery if the baby wasn't coming out. And there might be concern that the fetal heart tracing doesn't look well. But these days, we do more vacuum deliveries where we put a suction on the baby's head and pull it out. But we try as fast as possible to achieve a vaginal delivery because it's much less complicated than a cesarean delivery. And once you've had a cesarean delivery, then with each cesarean section, there's more of a risk because you get scarring inside the abdomen and it might be difficult to separate organs from one another. And yeah, it's just more complicated. So we usually tell people 3 at best, ideal. A 4th one is much bigger risk. Occasionally see people come in for on a rare occasion, I've seen this 7 C-section.
All right, so that's going to be passed. Oh, go ahead.
Sorry, I just
Okay,
wanted to make a
that's
point real
fine.
quick, because I like how she had wanted to differentiate what was natural, because I know that it can also be very traumatic to a mother who is prepared to do a vaginal delivery and then is told that she has to do a C-section. Mentally, physically, it's a lot, obviously, because recovery after the C-section, now you have to recover as well as trying to take care of a newborn baby. And then just mentally, you feel like you didn't do your job completely right, like everyone, well, not everyone, but most mothers, when they think of giving birth, they think of a vaginal birth. But there are pregnancies from the moment you get pregnant, they can let you know, even before you're pregnant, they can let you know that, oh, you won't be able to deliver vaginally. You have to do a C-section. Usually from day 1, they tell you. So sometimes you know the risk, sometimes you don't, but it can be very emotional to be able to realize that your birth plan isn't going through as you signed up for. I actually had 2 friends this last year who went in, their plan was vaginal births. Both of them had Black doctors, which was something that they requested, African-American female physicians, and just to be an advocate for them. And for both of them, and it was so crazy, they both wanted vaginal births, but they ended up both having C-sections. But the doctor was able to advocate for them so much to the point where it's like, all right, I'm gonna try to get you to do this vaginal. I know that's what you want to do. I know that's what the plan is, and we're gonna try to get that for you. And it wasn't until the very last minute. Like, I think one of my friends, she held out for a couple of hours, and they were like, "All right, we'll keep coming and check back. Like, your baby's good, you're good, so we'll just come and check back." And then when the baby's heart rate started to finagle a little bit, that's when they were like, "All right, we're pushing it. Think we might have to consider," but also, getting all the knowledge that you can before it happens, just to calm your nerves a little bit. Some people are stubborn. Some people are like, "No, hold on, my baby's coming. He's gonna come, or she's gonna come." So I think everybody's birth experience is different. So whether, like you said, the natural isn't a good thing, it's more so what's good for you, what's natural for you. So that's a big thing to consider.
That's going on to Ms. Kim Mazzoni. What are some signs of labor and the role of a doula?
Okay, so you said some signs of labor and then
Yes.
the role of a doula?
Yeah.
Oh, okay. So our bodies are so amazing that they start actually warming up before we actually go into labor. You may have some tightening sensations. Your obstetrician or midwife may refer to it as Braxton Hicks. Braxton Hicks was actually a physician, a British physician, who was the first one who first wrote about these warm-up labors. Sometimes you'll hear it called false labor. I like to call it warm-up labor because your body is working. It's getting ready for what it's designed to do. So during this time, though, there's very minimal cervical changes. You're just, like I said, your body's getting warmed up. And there are different ways that you can go into labor. In fact, even if you have multiple babies, your labor may start differently every single time. And so a couple of the things, I just made some notes here for you that you can consider. Yeah, it's actually oxytocin that is released by your pituitary gland that causes your uterus to start contracting. And when you are actually ready to go into labor, those contractions are going to become rhythmic, a little rhythmic tightening. They become longer. They become greater in intensity, and the frequency increases. So that's how you know I'm actually now in real labor, that is happening. And those contractions will start along the lower back and then kind of work their way around to the front. And if you go and take a shower or you lay down for a little bit and those contractions continue coming, and like I said, getting closer together, getting longer and getting stronger in intensity, then you are actually going into labor. Some women find that they just need to move their bowels and they might have a soft bowel movement. Sometime along the way, you have this wonderful little uterine seal that's made out of mucus that is going to dislodge. And you may look, sometimes you may see it when you go to the bathroom, but that will start to come out. You may have some birth show. You may start having some bleeding. It might be just a light pink or slightly pink or bright red. And another thing that might happen is your membranes might release. You might actually have your amniotic fluid come out. It could come out at one time, or it can be a very slow trickle. If that is the case, that happens to you, this is one of the things that your obstetrician or midwife will say, call me right away. We're going to want to know if that happens, because we want to make sure that we are monitoring you at that point to make sure that there's no infection or anything that can develop with the baby. So you always want to look and see, is there any color to that amniotic fluid? How much amniotic fluid is coming out? Is there any odor to it? So those are some things that your midwife or obstetrician will want to know. Sometimes you might just have a nagging backache and, trying to change positions, trying to lay down for a little bit, that doesn't go away. Most women we call it the nesting instinct, but you get this unusual burst of energy and you want to clean your whole house and you want to do everything on your list that still has to be done before that baby comes. But every woman's body is different. And like I said, every labor is different. I know for my first labor, well, actually both of my labors, I had back pain. But for my first labor, like I said, my baby came almost 7 weeks early and my membranes released. And I jokingly said to my husband, well, either I just peed my pants or my membranes just released. And so it's different for every woman. If you ever have any questions though, reach out to your care provider. And they will be willing to answer your questions and give you any information. Then as far as having a doula, the importance of having a doula to work with pre-pregnancy and for your labor. So a doula is a woman who has been trained to provide emotional, physical, and spiritual support to you as a couple through your birthing experience. And as a doula, when I was doing, I don't do that quite so much anymore now that I'm an intern midwife, but I would meet with a couple at least once before the birthing experience and talk a little bit about, what they can expect in a birth, how they can support one another, and how we could work together as a team. I would ask them questions as well as share with them different options that they have for laboring. Would share with them what to expect, if they were at the birth center or whether they were going to the hospital together. What are some of the things that they're going to expect are routine procedures or standard of care, so that they were aware of that. I would also talk with them a little bit about newborn procedures. What's going to happen to your baby after it comes out? What are your options as parents? Because in the absence of, a medical need, you can decide what is going to happen with your baby. Now, in some states, you might have to sign, like I know in the state of Maine, for certain procedures or things that you may decline after informed consent. You have to actually sign a form saying, I am declining this. But we give you education on that so that you were aware and can have informed consent. And then we would talk some about breastfeeding and getting you set up to successfully breastfeed. I would walk with the couple Okay, dad, this is a way that you can support mom and how you can work together during the laboring process. Because my role was not to take the place of the father, but to actually provide suggestions and provide support for the couple. And then we would work together once we've talked about how you would prefer your labor to come through. I know some people will put together a birth plan. I like to call it your birth preferences because we have a way we want our birth to maybe go, but things sometimes don't always go as planned. We can't control what happens in the process. And so being able to have that flexible mindset. So if your obstetrician comes in and says, I'm making this recommendation because I think it's best and safest for you or the baby, that we can be able to go with that and to realize no matter how this flow comes together, I'm going to have a healthy baby in the end. And so we write up those birth preferences. And then when a woman actually goes into labor, I go to their home or meet them at the hospital or the birth center and am there with them through the whole process. And I am so grateful. There are some wonderful labor and delivery nurses. I've worked with some of the best, but they come and go on their shifts. Your doula is going to be there from the start to the end of this process, supporting you. I do aromatherapy, I do massage, I bring in hydrotherapy skills, anything we can do to make mom comfortable. And I also do that for dad too. We try to make sure that you're getting your questions answered, that you have an integral role. Sometimes it's, going down to the cafeteria and getting food for mom and dad. So my role is to make this as comfortable for both parents as possible. And then when you're a mom in the middle of what's happening in your body, sometimes it's hard to maybe hear or to communicate as you have nurses and you have medical providers coming and going. I can help be a bridge between you and your provider and make sure you're understanding what they're recommending, or to be able to make sure that communication is staying open between the couple and the providers and the nurses or people that they may be working with. And then postpartum, I am there at the hospital or at the birthing center with you until usually I'm there for 4 or 5 hours after, just giving you your space, but there to help facilitate breastfeeding, to make sure that you've connected if you're in the hospital with the lactation consultant, that you're getting the services set up and that you feel comfortable. And then I usually do a postpartum visit once you are home, to make sure that breastfeeding is going well, to answer any questions that you may have, and to help provide suggestions for community resources if you need them. So those are some of the benefits. And I will tell you, some of the research that's been done has shown that couples who have doulas during their birthing usually have better birth outcomes. Their labors are usually shorter, and they feel like they have had continuity, of care as a couple and with their providers.
Well, that's fantastic.
And they also have a decreased risk for C-sections.
Okay. So the last question on this session is relating to importance of birth classes and childbirth educational approaches. Could you throw some light on that, please?
Yes, I can. So actually, as she mentioned earlier, I work with Glow Mom. So it's a nonprofit organization that focuses on providing pregnant women and mothers, typically with kids age 0 to 2, with all the resources that they need. So it's like a one-stop shop kind of thing. So we provide like financial resources. We link people with doulas if they need. I know Mass Health just recently expanded coverage in Massachusetts for doula care. So that's like one of the big things that we do. Doulas are so important. I just want to point that out real quick. I know for my master's degree, I focused on Black maternal health and the maternal mortality that we have been facing recently. And I feel like doulas have played, and there's research that's been done, doulas have played a big part, especially in African-American families, for the mother and the father, for better health outcomes. Like she said, it's a lot of stuff that happens once you go into the hospital. So having that person that can be there to be that person in between. I don't know if you guys heard the story about Serena Williams and how after her birth, she was the one that kind of had to literally get up from her bed after giving birth to go find a nurse to be like, something's wrong, something's up. So a doula would kind of be that person, be like, how are you feeling? Is there something different going on? You know, like, especially after birth, like mothers can be so tired, so fatigued that you think those symptoms are all a part of postpartum, when really it could be something more serious. So I definitely just wanted to point that out. And the emotional support as well. I feel like a lot of Black women, they don't feel heard. So having a doula there is great. I mean, obviously husbands are great too. Partners are, they're amazing too. But sometimes the woman is usually the one to speak up and speak out. But so yeah, I just wanted to point that out real quick, just to piggyback off. But importance of childbirth classes and any classes that go towards it, like, I know breastfeeding classes is something to take into consideration, because I know that can take an emotional toll on women when they feel like their baby isn't latching on. You know, it can be very emotional, or maybe you're not producing enough milk. So like making sure that you have the right tools, or that you know what to do in the case that, say, you have clogged, you know, and people say, put the lettuce on, you know, like stuff like simple things that you can do to help make the process go a little smoother. And childbirth classes, honestly, that helps you to prepare for childbirth. It helps you to know everything that can possibly happen once you're in the hospital. So it's definitely something that's important. And I will say, like, if you can join prenatal support groups, that's very important. Being around like-minded people who have the same goal, want to give birth to healthy babies, is undefeated. And also even postpartum, I would say for the for the partner or the mother herself, finding a group that you can be able to talk to postpartum, like new mothers or new parents groups, that kind of helps as well. Just to help with that transition from, you know, being parents, I mean, being a couple to being parents, because it can be a lot to take in. It can be a lot, because I feel like no matter how much you read, no matter how much research you do, nothing prepares you. Nothing can prepare you for the journey that you're about to head on. And that's why everybody's process and everybody's experience is different. And I think one of the biggest things, like we've said today, just making sure that you have the knowledge yourself, is because you don't have to listen to everybody. You don't have to take everybody's opinion on how you should do this and how you should do that. Just because your mother had 5 kids and they were all, you know, turned out great, it doesn't mean that you necessarily have to take their advice. So classes, support groups, all those things are resources to help you feel empowered to be able to take control of your body and what you want to do moving forward. So it's very important. I know sometimes they have free classes. A lot of breastfeeding classes are free. It's usually a community thing. Glow Mom, we do breastfeeding classes as well. I know for sure it can be a virtual thing, but sometimes hands-on are better. But yeah.
All right. So for this session, I was thinking of how to summarize it. I think it's important that we approach this session with delivery with an open mind, knowing that we have various options to have the baby, but things change, right? Just accepting things just the way that they are. Looking at support from experts in the field, recommending the doula, you know, if you can, making sure that that's a priority. And I'm very glad that Mass Health is in support of that and trying to make it more affordable and available across the tiers of health. I think I'm thinking psychology with the three-tier system. So we're going to move hats now to the last session, which is postpartum. And this first question goes to Dr. Zach Mazzoni. So benefits of 6 weeks recovery time and the concept of baby moon.
It's a funny question to ask me, I think, but I'll be happy to take that. You know, if you travel in different parts of the world, most of the world has an appreciation for the fact that recovery time is necessary. in the United States and in different situations. Sometimes that's not able to be the ideal, but really the benefit is numerous. First of all, it took 9 months to get pregnant. It takes a woman's body on average about 9 months to get unpregnant. There's a lot of things that are happening in this time frame. Your hormones are changing, but you're also trying to bond with the baby. You're also trying to establish a new rhythm in your home, especially if this is your first baby. Second is also a change. So there's a real need, if you can have this, for some time and for some support. So this will be my encouragement is if you know someone who's pregnant, they could use support. And often what happens is they get a ton of support initially, and then it goes for a few weeks, and then the newness rubs off, and then all of a sudden you've got a mom and she's 3 weeks, 4 weeks, 6 weeks into it, and there's no help. And that can be really difficult on a family or on the female specifically. Also that your sleep is interrupted. So this is a time where you're really not at your top, and it takes you a while to be able to establish good breastfeeding habits, to establish what the rhythm is for the baby. Really important for the baby to learn habits as well. A lot of times people will say, well, the baby just needs to kind of do whatever the baby wants. Babies don't know necessarily how to feed. They don't know the rhythm. And you want to be very gentle in how you do that. But establishing a rhythm in the home is actually helpful for the child. It's very helpful for the mom. And it's also very important for the dad to be able to connect, because the dad has been, if they're present, the dad has been really absent, if you will, because it's really all about mom, and it needs to be. But now when the baby's born, and then it starts to go into more of a family dynamic, and dad really needs to learn how to get involved in this family system. And it takes a while for that to happen. Additionally, that's a very special time for the family. You need to support, but the family needs time alone to be able to figure out how they're going to do family. I love what you said earlier, is everyone's different. And just because someone else did it doesn't mean you have to do it. You need to find a rhythm and a balance that's going to work within your family. But it's really important to be able to have that time, because this is when times from a medical standpoint, this is postpartum depression is going to highlight during this time frame. Thyroid is going to change during this time frame, and you want to watch labs. You want to make sure that the baby has what the baby needs, from vitamin D to B12 to iron. This is a time when feeding problems are going to present. If the baby has difficulty with tongue tie or lip tie, that's going to present at this time. Mom may need help as far as lactation consultant. This is a really important time. People think, okay, I had a baby, and you may get the inference from the hospital is, okay, you're good to go home. That doesn't mean you're done having your baby. It means the hospital's part of really being there to assist has been completed, but it doesn't mean that really all the forming is happening and completed. So I really advocate for that. You know, you hear different terms, baby moon or a time together, but you really need to be able to have that time. And what I encourage people to do is to try to set up a network of people that can support you. You want a good healthcare team to be able to support you that you trust. You want to meet with them and talk about questions. I love doulas and support, obviously, from that standpoint. But you also need to set up your social team, whether that's through your church, whether that's in your friend group, to be able to have them support you afterwards with food, with, hey, can I just watch the baby for a little bit if you need time to go to appointments? What is necessary during that time? Because there's a lot of things happening with people who are pretty tired and a new baby, and they just need a lot of support. So I'm sure I missed a few things my colleagues will improve on here.
That's all right.
I just
Go
wanted to
ahead.
mention, especially those first few days when you're coming home with your baby. Everybody's gonna be so excited to see your baby. Everybody's gonna want to see it and stop by, or they're gonna want to call your phones. Yes, kiss it, kiss you. It's okay to tell people, even family, we're gonna have a few days by ourselves just to settle in, and we'll let you know when we're ready. And even on your cell phone, or if you do social media, you can put the baby's height and length and the weight. People are going to want to know all that. Yes, baby's here, but that does not mean you have to answer every phone call or return every text, or get on and respond to every social media post that comes through. Really set that aside and really focus as a couple. And there's going to be time for people to come and people to connect. And even taking your baby out, other than maybe, going to your follow-up appointments, it's okay to stay home for a little while and just enjoy that time together.
Right. So the next question here is for Dr. Price, Edens Price. What are some community supports for young couples postpartum?
community support. Maybe you want-
Sorry.
So real quick, I just want to touch on, because the support is obviously to prevent any issues post-pregnancy. So I just want to take some time to focus on postpartum depression. I know that was the biggest thing last year. For Glow Mom, our theme was bounce back culture. And we named it that because we're trying to teach mothers how to bounce back after being pregnant, after adjusting to this new life that they just, gave birth to. So, postpartum depression was one of the main things that we pointed out. And so I just want to take some time to just talk about that real quick because it's very important. But it usually happens within 3 months after delivery. Some of the symptoms to look out for, and this is good for mothers and father to know. Grandparents, friends, everyone should be aware of these symptoms to look forward to, especially in pregnant women, because 9 times out of 10, they don't say it. They don't speak about it. So it's usually feeling sad, lowing mood, insomnia, crying spells. So just literally randomly crying for no reason, but there is a reason. Feeling agitated or irritable towards your partner, towards your loved ones, and like to stand out is honestly sometimes your baby. Sometimes you don't have the feeling to take care of your baby, and that's something to look for. Loss of interest or no longer enjoying things that you used to do. Some things that gave you pleasure, that something that you were looking forward to do once you gave birth. Like I know a lot of people, it's like a trend on social media where mothers show their first meal after giving birth. And some of them are just the happiest. So it's like little things like that. But if you don't have any inkling to want to do that, then that's something that can be alarming. And I did mention this earlier, but if you do have a personal or family history of depression or anxiety or any mental health issues, that does put you at risk for postpartum depression. So obviously you've had a therapist that help you control depression prior to, then they can also lead you through this as well. I mean, obviously there are interventions. I'm not really a medication person, but there are interventions like medication and stuff like that. But the best thing is really just to seek that help and that support from the people around you, so that you don't have to add any other stress or any other factors into your body while you're still trying to heal. Medication might not be the first or the best option for someone who's 6 weeks postpartum. So another thing is that can put a mother at risk for postpartum depression, not including if they had a history, as well as also if your baby's sick. If your baby has any complications, the baby has to stay in the hospital for any reason. Colicky babies that are crying all the time, that can contribute. Other stressors in life, lack of support system. Single parents are usually at a higher risk, or I know we had mentioned before about making sure that your issues within your marriage are good prior to, well, not prior. I mean, we should always make sure your marriage is on a good standing, but if you have any marital or relationship conflict, that can also add to stressors and it can contribute to postpartum depression. Some things is sleep. I know it's harder, it's easier said than done, but they say sleep when the baby sleeps. It's very important, very important. Like she said, limit the visitors when you first get home. Tell people, no, you can't come. Give me some time, give us some time. You don't have to, like you said, you don't have to answer every call, because that can be a lot when everybody sees that, oh, you gave birth and now everybody's blowing up your phone. And sometimes, like people like me, you kind of feel bad that you're not answering every call and you're not, I hope people aren't mad at me. No, it's okay to be selfish during these first times. And that also helps with fighting that depression. Like I had mentioned before, join a support group. And even though you don't want your family and friends like hovering, you can still keep in contact with them. So give them a call at any time. Just don't isolate. Don't isolate yourself at all. And the biggest thing I will say, ask for help. Ask for help is the biggest thing. And that's why I'm going into the community resources, is don't be afraid to ask for help. Because I know that everyone tries to, like, this is my child. I want to be the one to do this, but it's okay. It's okay. You're not any less of a mother, any less of a father, just because you needed to ask someone else for help. And that's why it's like community support is very important. And I talked about those, support groups that are literally available from the time you get pregnant, even before you get pregnant, because there's like fertility support groups too. So just finding that community that you can have. I know that especially as a church, there can be like going to the pastor and being like, hey, this girl, she just, this woman or this family, they just had their baby. It'd be nice if the pastor or the elder can go over, pray with them, give them some courage, give them some support. Because like you said, it all works together, the physical, mental, spiritual. Sometimes you just need a little lifeline to God. Like, hey, God, this is new for me. Just help me, guide me, and help me to feel confident in every step that I'm taking, every decision that I'm making for my child from here on out. So I think that that's very important. Yeah, so you did say church and community, but I think especially in the church is just being aware, reaching out, sending a card, little things like that are helpful to new parents when they're at home alone with their baby. Well, I don't want to say alone like that, but yeah, it's very important though.
So I'm just going to ask one last question. We have like maybe two, but we're not able to get to at this point. And this is for Ms. Kim Mazzoni, considerations for breastfeeding after a C-section.
Okay, Dr. Eloise might be able to talk about that.
Yeah.
But I know the big thing is that usually they say that to breastfeed right away for the bonding purposes. And I know some of the C-sections that I have sat in on with the baby immediately. They brought the baby to mom to put to breast. And so you want to still have that bonding connection. The big thing to really think about is to work with your care provider on what kind of medications might be recommended. Because certainly if you are going to be taking any opioids, you are not going to want to breastfeed. So really talking with them and finding out what are the recommendations, what's this, generally regarded as safe. I know in the birth center where I work, we have a milk bank. We have moms who donate breast milk, and those moms are screened very closely. We have, very strict guidelines to go with. So if we have a mama who ends up, with a C-section or needing to take medication for whatever, has a situation come up, then we can provide breast milk for them to help them get started until they are able to possibly do that themselves. But I don't know, Dr. Eloise, do you have something more you want to say, since that's what you...
Go ahead, yeah.
Yeah, it's really is no different between giving birth normally and having a C-section. The only difference with the C-section is the woman is in pain and needs pain medication. And it's still important for them to breastfeed. So we don't find that giving them opioid medication to reduce the pain affects the baby. So we give them and we encourage them to breastfeed. But I mean, everybody's different. Some people don't have that much pain that they need opioids. They get by on the Tylenol and the ibuprofen, but some of them do need something more, and we don't discourage them from breastfeeding because we don't find that it has that much impact. So it's more or less the same for a normal delivery and a post C-section. It's just the pain, and the mother might be as active as not having had a big surgery.
Go ahead.
Just I've seen this so much, I think it's worth comment. You really want to check in if feeding does not look like it's going appropriately. You really want to say something. And you really, I think it's worth just having a lactation consultant. I will tell you, I've seen situations numerous times where the lactation consultant sometimes has been cursory. And this isn't a statement about the individual, but that they miss that there was a problem with breastfeeding. And then that continues when you leave the hospital. And it's difficult on mom and it's difficult on baby. And there's been a real increase in lip tie and tongue tie. And what happens in a situation like that is it makes the breastfeeding ineffective, and it doesn't allow the baby to get the kind of nutrition that the baby needs. So, you know, in this, you've just had the baby, this is great. If breastfeeding is not going well, you really want to talk to somebody. And there are great consultants out there and there's great support out there, but I'd really make sure that you reach out and that you have a good feeding plan that you're comfortable with mom and baby before you leave the hospital. If not, then continue on in a birth center or continue on with lactation consultant, because these consultants are fantastic and they can really help you to bond with your baby and making sure that the whole feeding process, because what happens is that if it becomes negative or it's painful for mom, a lot of moms will stop. And one of the best things you can do as a mom is to continue to breastfeed for 6 months at least, right? One of the best things for baby is breast milk. So this is so important to get that started initially. So again, if you feel like it's not going well, really speak up, make sure you have a good plan.
Right. And a lot of time the mothers say, oh, I don't have any milk. Well, of course, you're not going to have a lot of milk at the beginning, but the only stimulus that your body knows to produce milk is when the baby is sucking. And so we tell them, just put the baby on the breast every time it's hungry. And then if you find that the baby is crying afterwards, you might offer them a little bit of formula, but really you should concentrate on breastfeeding. And then some people, because you're telling them, okay, it's best for the baby, some of them really don't want to breastfeed, and you shouldn't make them feel guilty. If you don't want to breastfeed, that's fine. It's better for you, it's better for the baby, but if you want to just give formula, that's okay.
In summarizing this session, which is our last session, we have so many interesting questions that came up, but we can't get through all of them. I have to say that one of the things that we need to keep in mind, you know, as the baby comes out of the belly, and is to consider the mental health of the mother. It's my area of expertise, but not with this particular population. Is very, very important. Body, mind, soul, spirit need to be aligned properly. So it's important that that's taken into account, as well as the supports that are available to mothers, that they know, they're aware of them, they tap into it from time to time, because that's very, very key. As I promised at the start of our conversation today, I said I have an opportunity to ask back to the panelists any questions that came up in our minds that were not covered within the 4 sessions. So here's an opportunity for you to ask your questions. Unfortunately, we're kind of bound with the mics. So if you can feel confident and comfortable coming forward to ask your questions to the panelists. Thank you very much.
This question is for Dr. Akosua Corbo. Since you're the person actually here who has the experience, I was wondering if there were some thoughts that came to your mind as you heard everyone go through all of those phases, and just something maybe from your own personal experiential knowledge coupled to your practical medical knowledge.
Oh, boy, that's a tough question. I guess the caveat is I feel as though learning about pregnancy does not really do justice to being pregnant, you know. So number one, it's like as much as you read and you prepare yourself, I think there's something about going through the process, you know, that's very humbling, you know, in many ways. I guess maybe some just like little tips and tricks that I honestly never thought about before I got pregnant was mercury. You know, I think that's a huge thing that I didn't know much about throughout training that I had to start paying attention to. Let's see, what else? I think just limitations of the body that I thought, you know, sometimes, you know, when you're not pregnant, you think some of it is exaggerated, right? You know, so like, people just want attention, etc. Whereas I said, no, it's actually real, you know? I remember I saw a physical therapist once who said, don't do any sit-ups. I'm like, why should I do any sit-ups? And I'm like, oh, this is why she said so. So I think, I don't know if that answers the questions, but I think it's little practical things like that. But I do want to just add one more thing that I didn't think we put on that I wanted to add on is, just the whole big thing of fertility. Because I think, in general, women, we're having babies later, for whatever reason, family, work, life situations, etc. And, as I said, I'm a primary care doctor. So usually my patients will see me before they go see OB and I'm not family medicine. There are no family medicine docs in my practice. So they kind of stuck with me. And, what I tell them usually is that, typically fine, you're in your 20s, etc. You can try for about a year or so, see how things go. But then what I do tell my older moms or to be moms, especially like 30s and up is if there's any issue, you've been trying for 6 months, no pregnancy, please let me know. Don't just keep on doing the same thing you're doing at home. Yes, there are fertility tracking apps. There's so many of them that you can do. You can time intercourse according to ovulation. So there are things that you can do. But I think the one thing I tell them is that if nothing is happening, please just let me know. Don't sit on it for long enough. So that's, I think, the one thing that I wanted to make sure I shared. But I hope I answered your question.
Thank you so much. Anybody feeling bold and has a question that's still lingering on? Go ahead. Thank you very much.
Thank you so much. I mean, great insights and discussions. So my question is trying to pick up, we were trying to differentiate natural, now it was assisted or not assisted. So I know it's Adventist fine, we have the health message, we believe natural things and all that, but it's not only us Adventists, even the research side, there's always a thought like, but how do animals do it? Like, are there no advantages from that and all that? And these days, there's a lot of talk about the microbiome, the vaginal microbiome. To say, in as much, we know that, we agree, in certain cases, it's not possible to do a vaginal. But maybe from your work and all that, is there much strength? Because science is science, but maybe the evidence is not strong. But there's a lot of talk about the vaginal microbiome and its role. That when a baby is born through C-section, maybe the immune system is not strong enough. Maybe if they're born through the vaginal, maybe they're going to benefit from the vaginal microbiome and all that. Maybe if you can talk us through that.
So who's going to answer?
I think I got voted into this. So the microbiome, realize that when we talk about this, what you're talking about, the microbiome is a system of bacteria, and that is actually in our entire body. And what we're learning from scientifically as we study this more is that it started in the gut as far as gut bacteria. There are more bacterial cells in us than there are human cells. It turns out that these bacteria, if they're properly balanced, provide the capacity for good absorption of food, breakdown of food, and protection of tissue. So these microbiome is very important. But what we're also learning is that the different types of bacteria that we have are fundamentally different. Our skin bacteria, even in regions, is different. The bacteria that's in our ear, nose, and throat is different. The bacteria that's in our gut is different. The bacteria that's in a vaginal tract is different. That is definitely helpful for a child. But the one thing that I want to really come away with that too is realize that there is an ideal. Call that, if you want, natural. I would prefer, I like the way Dr. Eloise said it, a normal, spontaneous vaginal birth. That was normal. There may need to be some help with that. If you get into a situation where you can't, you do the best with what you can. If the baby wasn't allowed to have the benefit of a microbiome for the vaginal tract, realize that the way it's designed is that there's a thing called colostrum. Colostrum is the first component of the mother's milk. It's about 55% saturated in fat, which is not something we should be eating every day, but really healthy for baby at that development. And it covers the stomach, which is about pea-sized, in healthy bacteria. And that starts the microbiome in the GI. So there's multiple ways for the baby to get that. And then you could say, well, okay, what if the mom, like Dr. Eloise said, doesn't want to breastfeed? You don't want to force this person or say, or to make them feel guilty. Oh, you really need to do that for whatever reason. They may have had a bad experience. Maybe they don't want to do it. So then you revert to another thing. Can you work with getting infant probiotics into the formula? Absolutely, you can. So you work to the level that you can. You know, there's certainly the ideal, but if you can't, you work with what you have. And there are ways to do that. And this is a burgeoning area of medical science. The types of probiotics and the health that they impart is tremendous. But I would look at that again, become an expert on that. There are good formulas. I would like to just take a quick plug on these. Be very careful what you do with supplementation. We talk about medications all the time. Medications have benefits, medications have side effects. You should be knowledgeable about both. Supplements have benefits, supplements have problems. You should be knowledgeable about both. There was a study that was done that showed that in the United States, about 25% of all supplements that were tested have nothing in them that they say that they have. This is why when you talk to certain people, they say supplements, those are junk. Why are you doing that? Or supplements I've seen be tremendously helpful. So when you're looking at your supplements, make sure that it is at a certified manufacturing process, which is on the side, that it's third-party certified, meaning someone has looked at it and said, yes, what's in there is in there, right? And then I look at, is this an ethical company that's trying to do good work? Because I think that does impact it. But again, this is for prenatals. This would be for the probiotics that you're going to use. So to your question, yes, that's wonderful. Yes, that's the ideal. Doesn't always happen. But then it goes back to our earlier point. Realize that moms, you have a huge role in what you eat is going to determine your bacterial counts. And there are different ones. And, you know, this is interesting because the research is coming out now that says that the types of bacteria that are required to break down meat and dairy products are a fundamental different family than the types of bacteria that are required to break down plant foods. And that those types of bacteria that are required for meat and dairy are actually more pathogenic, meaning disease-causing in nature. And that's why those types of food, among other things, can be more damaging. So to mom, it's important for baby to have it, but it's also very important for mom to eat healthy and to be able to make sure that she has a good microbiome to be able to give to baby. So I don't know if that answered the question. Hopefully it did. Okay.
Yeah. But it's time. We've been sitting for such a long time. We have 2 minutes more. I think we ought to celebrate and thank God for the tenacity, the discipline, the training that all of our presenters have had over the years and how they've gifted us this afternoon with the opportunity to learn and be informed. So God bless you. And thank you so much for the opportunity to have learned and listened to you as you taught us. We would encourage us to continue to grow in our knowledge of maternal health together, right, as a family, whether it's the partner and the individual who is looking to have a child. I think there's also the extended family, right? There's a church community. We cannot rule out the fact that there's no knowledge loss, right? At different points in our lives, we might be somebody that somebody decides to confide in. And I think in this day and age with lots of information, at least we might be able to point them to resources. Speaking of resources, Dr. Zach Mazone and Ms. Kim Mazone have put together some handouts for us. There's also some books over there for us to come by and just look around if you want to get those books going forward. But I'm going to ask that we pray. King of the universe, Lord, we thank you. You're amazing, you're good, you're kind. Thank you, Lord, for the opportunity to have this discussion. As I've just reflecting on how this might have just been like a conversation between you and somebody who said, I want to know a little bit about what that process is like, right? And behind the scenes, you allowed her to be connected with all these experts who came to us today and taught us about maternity health as well as child health. We ask, Lord, that your name be glorified because you alone are God. We pray that the seeds that have been sown today, that they yield much fruit, that we use them in our personal life, by extension, share them with our family, our friends, and get the support that we need early on when we need them. I thank you, Lord, because you're amazing. We give you all the praise for all that you are. We ask that as we go home today, that you please protect us from every form of evil. Have us have a wonderful last few hours of Sabbath. More importantly, help us have a wonderful week ahead. We thank you and we praise you and we ask that your name be exalted. But in your name and by your grace we prayed. Amen.